Welcome back to Jersey Matters. Contact tracing is a way of finding out how many people have come in contact with someone who tested positive for COVID-19. It is considered essential in fighting the disease, and Rutgers University is on the cutting edge. Here's my interview with Professor Joel Caplan, who is the director of the Rutgers Center of Public Security. Let's talk about why contact tracing is important in a pandemic.
Well, it's important to understand where disease originates and how it spreads. And contact tracing that focuses on individuals looks to see where the same people are at any given moment in time. What we're interested in is looking at contact tracing that considers the places that are the vectors for the disease, regardless of whether or not people actually interacted in the moment.
And that's important because people can avoid those places and avoid getting infected?
More importantly than people avoiding those places, it helps to optimize limited resources and direct them to the places that need the most.
Except in other countries, they have been able to stop the spread much better than we have in the United States by using contact tracing. For instance, South Korea has had great success with contact tracing. Am I correct?
A common form of contact tracing looks to see who you're interacting with and then who that person interacts with and then follow that cycle forward. A successful form of contact tracing uses a backward trace to identify clusters from where people that are infected today were in the past. What we're doing is we're taking this one step further with the app Flatten that's based on spatial analysis focused on places that originated at Rutgers. And we're looking to see how certain places attract people to encourage behaviors that could increase the likelihood of disease transmission. And then resources can be focused on those places. You know, a lot of the discussion around COVID and disease transmission focuses on places. Policy decisions are based on this. We close bars, we close schools, we close hair salons, and then we decide to open all of these things. But we don't really have a good way to collect data about which ones we can keep open, which ones we can close, and which ones, if we reopen, are likely to spread disease further. And this is a way to get at the place-based nature of the policies that we're using to fight COVID.
It's vitally important for a whole lot of reasons. And just to let the viewers know, Flatten is the name of the application that you have come up with that you just referred to a second ago. I want to get into exactly how it works. But before we do that, let's talk about the pushback in this country against contact tracing, and it has to do with privacy.
Privacy is a big issue, and one of the things that we need to realize is that the effective contact tracing relies on people to participate in the tracing, and when we call it tracking or when we use technology to enable more efficient contact tracing, there's a lot of things to take into account, one of which is everybody needs to be using the same contact tracing app in order for them to talk to one another and be effective in reaching connections that are made among individuals across a broad population. So with a lot of different contact tracing methods, we have limited resources and potentially limited buy-in.
Yeah, limited buy-in is an important point of this. I read an article on contact tracing where they said the governments where it's been successful are governments that can either force their population to use it and or have more trust from the people in using it, and that's not happening in the United States. Is that
trust is really important? Implications with regard to liability. What does it mean if you know you have it or somebody told you you do and you spread it to others? I'm not sure the technology has necessarily caught up with the laws or people's concerns about liability or people's concerns about privacy. Who's collecting the data? Who's maintaining the data? Do I want people to know where I was? Do I want people to know who I was interacting with? These are all, real concerns that need to be addressed in order for the technology to catch up with the sentiment among the population.
It seems extremely important, but it doesn't seem like it's taken off so far in the United States. How has your app been received?
Or so far, it's been well received. We've been directing it not towards a general population, but people who are really on the front lines: police, firefighters, EMTs, food delivery drivers, social workers. Frontline workers encompasses a lot of different employees and people and volunteers who work and engage with people in the community. And among that community, among that crowd and that population, the app has been well received because it doesn't focus on who they're coming in contact with. It just looks to see where they were. And if they end up being positive, then it can overlap a bunch of different positive results anonymously to see if there was a place where they all came in contact with and possibly contracted the disease. And really, it's a way to protect your peers, really to help protect those who protect and serve you.
It's not going to happen in this country, but if this country were to accept contact tracing universally and everyone were to take part in it, how much safer would we be?
Contact tracing is a proven public health strategy to limit the spread of disease. It's effective and it works. Evidence shows that it does. So if we could get a comprehensive contact tracing strategy that was not just focused on people and forward contact tracing, but also backward contact tracing, identifying clusters and also identifying places that might be helping to encourage the spread, it would be widely effective.
All right, sir. Thank you so much. Good luck with the app. I really appreciate you spending the time to tell us about it. Joel Caplan, professor at Rutgers University. When Jersey Matters comes right back, we will introduce you to Atlantic City's first woman deputy police chief. That's next.